Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. I
Yes.
just want to get your feedback about the ACN course. What do you think
Yes.
about it? Did it prepare you to really start working on patients? Yeah.
Yeah. So ever since, so I first did advanced soft tissue release course, and I started practicing those, and I was already seeing the good results, most of the musculoskeletal cases, but there were some chronic cases where I had some challenges, and I
Mm-hmm.
decided to go ahead with the advanced clinical nutritionist course, which I completed within a year, and now I'm applying that knowledge and do the nutritional assessment, and it has helped me to treat all those chronic cases which I was not able to solve for some of the cases,
Mm-hmm.
and the results have been wonderful. uh, I would say the success rate is about 90% plus with all of my
Nice. Mm-hmm.
clients,
Mm-hmm.
and I'm getting every like word of mouth advertisement. I'm not doing much advertisement,
Mm-hmm.
and people are just coming one after the other ever
Mm-hmm.
since they hear from clients. So I'm quite happy with the both courses I have done, and it is helping me to give uh, the results which I never expected with a traditional physiotherapy.
Yeah. So, what do you think about the course? Is it easy to follow and learn on your own pace online? What's your
Oh yes,
feedback?
everything is online, and you can do at your own pace or your own time, and it's like detailed, step by step and well organized.
Okay. So, when you finish the course, how easy it was to start to implementing with the protocol you have? Was it like very smooth transition, or it was took you a while to get the hang of it? So, what do you think?
I think it was pretty easy to implement all those information and knowledge what I acquired through the course, because it is more like practical approach what you have been teaching even in your courses. So
Mm-hmm.
uh, I had no difficulty. Like I from day one, I have been implementing those all the techniques and plus all the information, and no, like the results are like they are like at the end of the treatment I'm seeing the results. Before
Mm-hmm.
I had to wait like weeks and weeks before I could see some improvement. Here it's like evidence based. You do the treatment, you recheck those symptoms, and client tells you like this is how much better they are. Most of the
Mm-hmm.
clients, what I have found, first session itself like 50% recovery.
Mm-hmm. Nice. So, what do you think about ACN forms that you use it with your patient? How easy to use, or what do you think about it?
It's quite integrative. So what I do when I assess and then compare it with the nutritional analysis form, and with that sheet you have given, it gives easy diagnosis like what could be the problem,
Mm-hmm.
and then you go towards like gear towards that, you do a nutritional focused evaluation, and it's even more picture clear at the end of the assessment.
Good. So, without mentioning names, can you tell me like a short story about when you implement the ACN evaluation on patient? What was their symptoms before, the symptoms after, and how long it took to really notice difference?
Yeah, so one of my client, she came, she is like between 35 and 40-year old, but she had a lot of symptoms, like she was complaining of severe tingling numbness in
Mm-hmm.
her right hand,
Mm-hmm.
and a weakness from shoulder to the hand, and also a chronic neck pain which was going from years and years. She also started experiencing not able to sleep until like 2 or 3 in the morning, not able to concentrate in her work as well as in her family life.
Mm-hmm.
After I did the ASTR treatment, plus I
Mm-hmm.
also did the advanced clinical nutrition assessment, and with that,
Mm-hmm.
within 2 months, she
Mm-hmm.
reported me that she has improved 80% in terms of her symptoms. She's no longer getting any tingling or numbness. She's able to work with attention and concentration. and her work performance has improved. Her boss is happy, as well as now she's sleeping well, which is in turn helping her to improve her pain and quality of life overall.
Oh, that's great. So how long she had that symptoms before she seen you?
She had that ever since she got married and before that, so I would say approximately 10 to 12 years.
Okay, so what do you think? A patient had symptoms and complicated condition like what you just said for 10, 12 years. How that make you feel that how many like you worked with her for how long and
Yeah, I
get
just
those
worked for
results?
two
How
months
this
and I worked for 2 months, and it gives you that inner satisfaction.
beautiful.
That you are trying to, you are basically able to help somebody uh, with a positive outcome in such a short time. I never expected that.
It's very
So
rewarding,
it's,
yeah.
yes, it's very rewarding for sure.
Yeah, awesome. Thank you so much. What would you say to healthcare providers about ACN course, like physical therapist, chiropractor, any healthcare provider? What's your thought about ACN course in regard of their career?
Yeah, so my suggestion is, if you are really patient centered and want your patient to be recover and enjoy their quality of life, they should definitely look into this, as we know that these courses are targeting the root causes of the problem, like pain, inflammation, and such, and it will improve your knowledge base also, and the results are fast and evidence based. Like, it's not that you have to wait for years and years. You see the result like within in a first session of treatment as well. So I would highly encourage any healthcare provider to take this course.
Awesome. Thank you. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.